Hi, I'm Aaron Powell, Director of Sports Medicine for FC Cincinnati, here for June's Medical Mutual training tip. In all of summer's activities, it can be easy to pick up an injury. Ice and heat are good treatment options, but can be a little tricky to figure out when to use each. I'm here in the FC Cincinnati training room to give you a little help in that area. First, let's start with ice. A very general rule of thumb is ice is good for acute injuries. An acute injury is typically a very traumatic injury that happened very recently, like an ankle sprain or a bruise. So ice is good for pain reduction and reducing swelling and inflammation. On the other hand, heat is typically good for chronic injuries. A chronic injury is an injury that lasts a lot longer. Overuse injuries like tendonitis or arthritis. And heat is good for reducing the stiffness in that joint and increasing blood flow. When working with ice, just grab your ice bag and find the injured body part. So let's say he has an ankle sprain. So place the ice, make sure the ice is covering the entire injured body part, and just leave it for about 15-20 minutes. Once you remove the ice, feel free to reapply, but wait about half an hour for that body part to warm up. If you have a freezer gel pack, make sure you lay down a towel before applying it, because these can get pretty cold and have the risk of damaging your skin. All right, let's fast forward a few weeks. This ankle sprain is almost fully healed. There's no more inflammation and swelling, but it's still a little stiff. So we're gonna put some heat on there and leave it there for about 10-15 minutes. This will be really good for that joint stiffness. You can reapply this several times a day or right before activity. If you don't have a professional heat pack like this, feel free to use the microwavable ones or the electric heat pads. Just be careful not to get it too hot. If you suffer an injury like that ankle sprain and it's not getting better in 3 to 4 days, please seek the advice of a healthcare professional. And that concludes your June Medical Mutual Training Tip of the Month. I'm Aaron Powell. Thanks for tuning in.